Hi everyone. Welcome to the channel. Thank you so much for joining. I hope you're all doing well. It is December. I have not done a live stream for a while. I think the last one was a few weeks ago. So I'm so glad to be back on one of our Friday teaching sessions. And I hope you're well wherever you are. Getting ready for Christmas, or if you're just going to be enjoying the holidays, it is so great to be back with you. We are talking about a very important aspect of birth control, but I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth, and I'm so pleased that you could join me today. Let's just get right into today's topic, because I get lots of questions from viewers who also want to know about the non-hormonal methods of birth control. We talk a lot about different birth control methods on the channel. So I thought this is a good opportunity to break it down and look at the non-hormonal methods. So in today's session, I'm going to be answering the following questions. What are the non-hormonal methods of birth control? So we're just going to run through most of them. We're going to talk about which methods are more effective and how you work out what effective means. And we're going to be talking about failure rates as well. And then towards the end, we'll just make a little mention of which of the non-hormonal methods depend the least on human error, and therefore they're most likely or more likely to work best for you. So it's an individual choice, the birth control method that you use. Whether a method is very effective or not changes once you apply human behavior to it. So there could be a method that your friend has used or you've heard talked about and you think, this sounds like a really good method. You need to add in your own mechanism. You need to add in your own nature, because that is what determines how effective the method will be practically for you. So all birth control methods, whether they're hormonal, whether they're not hormonal, they are at least 98% when used perfectly. Yes, you heard me correctly. The method itself isn't the problem per se. If the method is used in the best way possible, i.e. perfect, it reaches 98%. However, when you add the issue of human nature, when you consider human nature, human aspect, the effectiveness goes down. So what do I mean? I'm just trying to remind us and explain that our human nature is less than perfect, can be irrational. It depends on our mindsets, our attitude towards preventing pregnancy, what we know, what we understand. It depends on our priorities, our values. And this last one is very important, skill. It depends on how well you know to use that method. And I'm going to break this down a little bit as we go into the different methods we're talking about today. And when we're talking about how effective a birth control method is, I want to make it very simple. I'm just going to stick to failure rate. Okay, I'm going to talk about failure rate. I know that in some cases we talk about effectiveness rates, that's fine, but I just want to make it simple. And let's talk about them in terms of failure rate. And that means you're talking about how many times or how many people using that method are likely to fall pregnant. That means the method has failed, okay? So we're talking about if you have a group of 100 people or couples, how many women or couples will fall pregnant using that particular method? That is the failure rate. That's what I'm referring to today. So I'm going to be using failure rates to describe the methods. But I also want to add that failure rates are just an estimate as well. And failure rates can vary from one group to another, from one country to another. So when you see these failure rate numbers of 10% or 20%, consider them, I don't want to say with a grain of salt, but consider them in context is the best way to look at them, because you need to apply your own context, your own practical situation, how you behave, what's convenient for you, and so on, to that method. And then you will decide, you can see how effective or how much it's likely to fail for you. Okay, so why do people want to use non-hormonal methods? It can be for so many different reasons. It can be just preference, just choice. You don't want to use a hormone, or it might be a medical reason. For example, you've used hormones in the past and they've caused horrendous side effects, and you think, right, this is not for me. Most of the times, the non-hormonal methods are easy on the pocket. They're not too expensive for most of them, okay? And you don't need a third party involved. So you don't need, for example, to go somewhere for somebody to give you injections, for example, or for somebody to fit the implant in your arm, for example, or somebody to fit your coil. So most of the time, the non-hormonal methods are, you don't need a third party, except for the methods like sterilization or even fertility awareness method, where you need to be trained to use that method properly. Okay. Also, with birth control methods, you're probably very much excuse me, with non-hormonal methods, you're probably less likely to have to worry about fertility. I've said that in such a long-winded, roundabout way. All I mean is that with birth control methods that are non-hormonal, you're less likely to have concerns about your fertility. So let's compare them broadly to a method like the depot shot, where from listening and watching my videos, or if you've used it before, that there may be some delay in return of your fertility. You don't have that most of the time with the non-hormonal birth control method. So just to give you a little bit of just a bit of background about these methods and why some people go for them, why they are appropriate for some people. So with a non-hormonal birth control method, for example, the condom, if you decide that next month is the month that you want to start having a family, then you just stop using the condom, and hey presto, you're going to get pregnant as soon as pretty much the very next time you have intercourse. So that's the way most of them work. So now let us look at different birth control methods. Okay, let us consider different birth control methods. I'm going to put up some images for you, as I always do, because I like us to see what we're talking about. If you're watching this on the replay, please don't forget to like the video, drop a comment, let me know what your experience has been with birth control methods, non-hormonal ones. Let me know if you got caught out. Let me know if you had any problems. Some of them do have side effects, and I will mention them as we go along. But I would love to know what your experience is. And I think this is just a great addition to our library on the channel, so that as many people are looking for different options, you know that they are the hormonal ones and these are the issues, and you know they are the non-hormonal ones and these are the issues. So let's just go straight in. The first one that we're going to be looking at today, let me just bring this up. So hopefully you can see this and you can see. So I'm just going to keep that on as we just talk a little bit about this method. So on the screen, I have the two different types of barrier method. So they have the male barrier method and the female barrier method. On the screen, the male, of course, is the male condom, and the other one is the female condom, also known as the diaphragm. Okay, these are very popular methods, but they do have their pros and cons. Obviously, relatively cheap. You don't need a prescription to get hold of a condom or diaphragm, and the plus which it has over, or the advantage it has over all the other methods, is that it helps to prevent sexually transmitted infections. That has always been a great benefit for these barrier methods. But to use it, you need to know what you're doing. For example, how do you store the condom properly so that in storage, before you use it, it's not going to get damaged or more likely to get torn eventually when you use it? That's important, okay? How do you properly put it in place? Apply it within the vagina before sex. That's the diaphragm. How do you properly fit the condom, the male condom? The other thing is that the male condom can also tear when it's being used. So the other helpful fact I've put on here, which I want everyone to have in mind as we talk about this method, is the failure rate. And I've defined the failure rate for you as, out of 100 people using this particular method, how many people are likely to fall pregnant within 1 year using this method? And for the condom or the diaphragm, roughly on average, you're talking about 13%. So just keep these numbers in the back of your head while you're making your decision, while you're thinking which one is effective for, more effective for me, which one would I prefer? But as I also explained, the failure rate also works in tandem with you. Your human nature, yourself, determines just how effective this method is. If you're just joining, hi, you're welcome. Please leave a comment. It's great to have you here. Tell me where you are watching from. How's your day going? You guys getting ready for Christmas or just enjoying the holiday break? Tell me something about what you're getting up for the next few days. We're talking about non-hormonal birth control methods. If you've got any interesting snippet for me and for everyone else watching. Let us know what your experience has been about birth control methods. Okay, so that's the first one that we're talking about today, condom, diaphragm, very popular method. And almost everybody, I think, would have heard of this method. So let's go to the very next one. And this is the withdrawal method. The withdrawal method, again, another popular method. If you want to learn more about this, make sure you go and have a look on the channel. I think this is under the Smart Birth Control Methods playlist. I will put the link in the description box for you later on, but it should be there if you want to go and watch. I've got 2 videos on the withdrawal method, everything you need to know about it, okay? But it's a popular method. It's used by couples of different ages for different reasons, okay? But the pros are that it's a natural method. Of course, it's free of any costs, no side effects. You don't need any expertise from a healthcare worker. However, on the other hand, it relies on the skill of the male partner. So there is a little bit of human behavior here, which is what tends to trump this method, which is what tends to pull its effectiveness down. It relies on the skill of the male partner to withdraw at the right time, which can be difficult, in the heat of the things, heat of what's going on. It's hard. It is hard. And for the female partner, you have to trust that your sexual partner will withdraw at the right time and not do the deed and then end up apologizing. Oh, he couldn't help it. Believe me, it happens. So I discussed the withdrawal or pull-out method a lot in those videos on my channel. Please check them out. But the key thing to mention here is that the failure rate for the withdrawal method is 27%. Okay, so just to bang it in your head again, what we're saying is that if 100 couples are using the withdrawal method as their method of birth control for the next 12 months, 27 out of them are likely to fall pregnant. Okay, so that is the withdrawal method. Let's move quickly on to the very next one, which is spermicide gel. And there are different types of spermicide gel or spermicide agents, but basically what these are chemicals that kill or disable sperm. Okay, there are different types. For example, dry gel, contraceptive jelly, or Phexi. They contain different things, or they're made up of different components, but basically what they do is that they kill or disable sperm. Now, they usually are a second birth control method. It's rare for them to be used on their own, and they can make methods like the diaphragm method to be even more effective. If you remember, we said that the diaphragm method could reach failure rates of about 13% upwards, but when you add the spermicide gel to it, it builds its effectiveness, and then the failure rate then drops down to about 4%. Imagine that. So the spermicide gel, it will not affect male or female fertility, and it's relatively cheap, but it could have side effects. So please be aware, okay? Things like pain, if some people's skin is sensitive to the gel, or cause vaginal irritation or redness. It could even lead to developing genital sores, okay? Which can lead to sexually transmitted infection. So that's something to be aware of. But if you're going to use a spermicide gel on its own, again, we don't advise that you do this, but if you are going to use it on its own, the typical failure rate is about 25 to 30%. That is a lot. That is a lot. So that means on its own, this is not a method to go to sleep on and think you're fine. This is not a method to use and, think that you're okay. However, like I've said, if you're using it as a backup to the diaphragm, using them together, then that protection shoots up. The effectiveness of that protection shoots up. So that is the spermicide method. Please don't forget to like the video. Let me know your comments, your experience. I know I get a lot of questions about this method, so I know it's something people want to hear about. The next one is the calendar method. The calendar method. This is also known as the rhythm method, and it is when you learn your fertile periods, okay? You learn about your fertile window from charting your menstrual cycle. So over a period of 6 months upwards, 6 to 12 months, you intentionally are charting your menstrual period. That is the day you come on, the day you go off, and that your period stops. You're charting this and you're looking at the pattern. Okay, now it tends to work better if you have regular cycle, usually between 26 to 32 days 32 days long cycle. Those are the people it tends to work better on. And this method it relies on you being able to calculate when you ovulate and then avoiding having unprotected sex around that period, because that's why you're working out the days when you come on, that is when you start bleeding, and the days when your bleeding stops. Because once you get that number and you sort of track it for 6 months or longer, then you're able to estimate when you're likely to ovulate. Because remember, ovulation will generally fall about 12 to 14 days from the first day of your menstrual bleeding. So this is how the calendar or rhythm method works, but you need to use it. You need to practice the charting. You need to be committed to doing it regularly. Don't forget, if you have an irregular cycle, it is unlikely to work for you. You may not get accurate estimations of ovulation. It is hard enough to get ovulation dates accurately, even with the app, because many things can affect ovulation. I get this a lot in questions. People say, well, my fertility app or my app said I'm ovulating, so we had sex the day after or the day, whatever the situation is. And always in the back of my mind, I'm thinking, well, these apps they will give you what you give them. The information they give you is based on whatever information you fed to them. In real life, your ovulation could be affected by so many different things. If you're unwell, for example, if you're under stress, certain medications, all these things can affect your ovulation. But back to the calendar method, the point is that while it is a natural method, you don't need to pay anything, you don't need anybody to guide you or whatever. You do need to be disciplined to maintain accurate records of your menstrual cycle. And the other thing is, you also have to be disciplined to avoid having sex, unless you're using another method, on the days when you are not safe. So it takes a lot. It takes recognizing that your pattern, recognizing when it is safe, and then the decision to say, right, I'm not doing this, or you're using another method. So you may have to introduce other methods, and you're not just relying on the calendar method. So good to have that at the back of your mind. But what is the failure rate of this method? For 100 couples who are using this method over 12 months, 25 of them could fall pregnant. So that is also a big number, considering when you think about the hormonal methods, if you want to compare them. But I don't want to go into that. Let's stick to the non-hormonal methods today. Okay, moving on. What is the next method we're talking about today? And it is fertility awareness method. Yes. This is a very popular method. Let me remove my ticker here so that you can see clearly. So this is the fertility awareness method. Yes. And in this method, you need to know the changes in your body that signal when you're fertile, so that you decide not to have sex at that time or use another method. So again, this introduces the whole aspect of choosing not to have intercourse at a particular period, or if you are going to do so, you use another method. So it doesn't particularly defeat the purpose of this method. It doesn't. That is saying that you might need to use another method. You can choose to abstain. So it's good to have that at the back of your mind. And really, methods like the calendar method and the fertility awareness method, the different types of fertility awareness methods that there are out there, they do need a lot of commitment and understanding and choice, that this is how I'm going to live, this is how I'm going to practice this. And it is more likely to work if you've made up your mind to do this. It's not something that you can decide, okay, I'm going to do this today, and then the next 1 or 2 weeks. No, it's something that you really need to be involved in. So it involves observing and interpreting signs of fertility during your menstrual cycle. For example, and commonly used, your basal body temperature, okay, and cervical secretion. So all this relies on the fact that during a particular time of a woman's cycle, when she begins to ovulate, there's a slight change in her body temperature. So slight that ordinarily we don't even feel any different. But actually, when you take measurements, there is a slight increase. So this is why you need commitment, because you're going to be checking your temperature at different periods during the month and charting them so that you can decide when you're safe or not. And the same for cervical secretion. So this is the mucus secretion that women produce from their cervix and comes through the vagina. And being able to identify the nature of the secretion that tells you, okay, this type of secretion that I've got means that I'm ovulating. So this method needs commitment, to checking the temperature, you have to chart it. So this is something that you can't just, it's not something that you do on a whim. That's what the point I'm trying to get at. It's not something you do on a whim. There has to be the commitment to being able to chart this information. And so you can identify properly when your fertile window is open and when it closes. Because if you're saying that I do not want an unplanned pregnancy, you're in a pretty different category from somebody who maybe is having the depot shot or he's having the pill, and that's all they have to do. You have to do a lot more. You really have to be committed to deciding. You can't assume. You need to be quite certain that on this day to this day are my fertile days, and so I cannot have unprotected intercourse in this period. You don't need all this. You don't need to think about any of that if you're on the depot shot or if you're on the pill. So this needs some degree of commitment. I think I've said enough about commitment to this method. You need to have the experience. You need to be skilled at checking the type of secretion, knowing the difference between the one that is happening around the time of ovulation from the time that just before you start your period, for example, because they're different. And to use this method successfully, you also have to have backup methods. I think this is really interesting. You also need to have backup methods to use with the fertility awareness method. That makes it more effective for you. Okay, so examples are, if you're using the fertility awareness method and you think, okay, I know this is my unsafe period, but we're going to have sex, then you have to use two backup methods. For example, the condom and a spermicide, for example, because what if the condom tears? Then you have the spermicide as a backup. So despite being on the fertility awareness method, you also will need to have backup. For example, like I've said, the spermicide and condom, or it could be using the withdrawal method with a sponge, or using diaphragm with spermicide, just as examples. I don't want to go into too much detail. That's not the purpose of today's stream. It's just to give us this information about the method. And probably another time we can go into much more detail about how the method itself works. But in terms of failure rates, because this is what we're interested in today, failure rate can hover between 3 to 37%. So for anyone just joining, let me break it down quickly. That failure rate refers to if 100 couples are using a particular method for 12 months, how many of them will fall pregnant on that method? And I'm saying that with the fertility awareness method, it can range from 3 of them falling pregnant to 37 of them falling pregnant out of 100. And all the variation, the different numbers, why isn't it one fixed number? It all depends on the individual. And I hope that if you're watching this with me or watching this on the replay, you're also coming away with the idea that these methods are all well and good, but when you apply your own individual nature and your circumstance to them, that might cause some changes. So that is the fertility awareness method. Thank you so much. If you're watching, please leave a comment. Let me know if you like this, and don't forget to like the video as well. That would really be fantastic. Let me know what experiences you've had with any non-hormonal birth control methods. Would you recommend them completely, or would you think this is not for me, and why? Okay, let's move on. And the next one is the copper coil. The copper coil. So the copper coil, or the copper intrauterine device. You guys would have, I talk about this a lot because it's also an emergency contraceptive method, and I talk about that on the channel. And how it works is it makes it difficult for sperm to fertilize an egg. It creates an environment where sperm can't travel very, very effectively, so they can't fertilize the egg. And it can also make it difficult for, if the egg has been fertilized, make it difficult for the embryo to be, that is the fertilized egg, what we refer to as the embryo, make it difficult for it to implant within the womb. So that is how it works. It doesn't require much behavior on your part, because once you've taken yourself off to have it fitted, you're good. That's it, you're done. And basically, the most that you need to do really is just keep checking the threads. And we ask you to do this every month, usually after your period, just to make sure you can feel the threads and reassure yourself that it is still present, okay? Because they can fall out. So that's the only thing that you probably need to do. It can remain in place depending on the type for 5 to 10 years, depending on the type that you've had. So of course, you would also be expected to take yourself off to the clinic when it's close to expiring, so you can replace it or get an alternative. So these are some of the things. It doesn't really need much to do, but in terms of the cons or disadvantages, you do need somebody who is experienced and trained to fit it in for you, and it could be costly. Some people may have to pay for this method. But of course, in terms of effectiveness, let us talk about the failure rate of this method. This is the smallest failure rate we've seen so far. And so it's between 0.1. Oh, that's supposed to say 0.1. So between 0.1 to 2.2%. Okay, so again, we're saying that if 100 people choose to use this method, we follow them over the period of 12 months, okay, about 2%, maybe two of them is the maximum. 2 people will fall pregnant. And this is the lowest that we've seen, all in the ones, I think we've seen about 4, 5 so far, or 6 so far, in terms of effectiveness. So that is the copper coil. And next, we're going to look at abstinence. Yes, abstinence is a method. I promote abstinence as a method. You can either decide on abstinence as a choice at certain parts of your cycle, when you know that your fertile window is open, or when you know that you're at highest risk of falling pregnant, or you can just decide that this is the state you want to be for a period of time in your life when you don't want to be sexually active. Abstinence is an effective method of birth control. We don't talk about it as much as we do, and it does have benefits outside of the fact that, of course, you're not going to fall pregnant because you simply ain't having any. So how on earth does it happen? But there are also benefits about for abstinence, particularly early on in a relationship for very young people and teenagers. That choice that it's okay not to have sex. So taking away the drive, or the I think the peer drive or the social drive to engage in sexual activity, I think it's important. And just sort of owning yourself and owning the choice that you make, and just, when you're ready, always the best. So that is abstinence. And the next method, and I think I mentioned the failure rate obviously is 0%, but that was obvious. So the very next one is sterilization. Sterilization is another of these non-hormonal birth control methods, and it is a surgical method, as you know. You can have the male sterilization, which is also known as a vasectomy, where the sperm ducts or tubes are cut and tied, okay? Or the female sterilization, which is the same as tubal ligation. And in that way, pregnancy is prevented by either blocking or tying the fallopian tubes. Now, either of these methods is highly effective. I have a comparative article on male and female sterilization, and I'm going to put that in the description, because somebody might just want to know. Somebody might just be looking and doing some research, and I actually put a lot of information together in that article. It's really detailed and good to read. So I'll put the link in the description for you. Now, either of these methods is highly effective, both of them highly effective. So whichever one you choose depends on your circumstance and your partner's circumstance. It's a couple decision. And there are different reasons that people can choose to go for sterilization, but usually advised at the time when you're sure that you've completed your family, or for medical reasons. So it can be different for different couples and different people. But it requires surgery. So possible side effects of surgery. And you need an expert, somebody who knows what they're doing, to cut into your system, either to perform the vasectomy or to tie the tubes. Can be expensive as well, because in some communities, in some countries, it may be available on a National Health Service, for example, as it is in the UK. But in some other places, you're going to have to pay for this out of your own pocket, or it might be covered with your insurance, and so on. And the other thing to be mindful of is not just in getting it done. If you change your mind, okay, this is why there is some counseling before you have this method, and there may be a number of questions to check that this is the decision that you want to take, and you're going to be happy to live with it. Because if you change your mind, it may not be possible to reverse it to an extent where you can go on and have become pregnant, or whether it's the man or the woman. No, I'm not saying it's completely impossible, but it may be challenging, and it might be costly. For example, in the UK, you can't get a reversal on the NHS. So you would have to pay if you think you've had the snip, or you've had your tubes tied and you want to reverse it, you would have to pay, okay? What about the failure rate? So again, so this is now in tandem with the with the copper coil. So these are the only two that have failure rates that are this low. So this is coming in at less than 0.15% on average for both of them. So less than 1. We're saying that if we had couples, 100 couples who were looking at, and this is the method that they use, less than, so hardly anyone is going to fall pregnant. Of course, no method is 100% foolproof. So what we're saying is that we will accommodate for a small number of individuals who may experience a failure of the method and fall pregnant. So this is a quick run through on some of the more commonly available non-hormonal methods. Okay, so remember at the beginning we wanted to look at the questions, what are these methods? And we've gone through 8 of them. We've talked about the condoms, we've talked about abstinence, we've talked about spermicide gels, we've talked about fertility awareness method, calendar method. What else have we talked about? Let's see. We've talked about the copper coil, and of course we just finished with sterilization. So we've gone through quite a few, and we've looked at the ones that are more effective, and I've used failure rate to indicate to you. So you can scroll through, go back through this video and look at from the least failure rate to the highest failure rate. So the one with the least failure rate is the one that is most effective, i.e. sterilization or the copper coil. And as you go higher in number in terms of failure rate, then the method becomes less effective. And I wanted to say to you, which of them then least depends on human error. So when you're thinking, which of these methods relies least on me and therefore more likely to work, then it's easy. Sterilization, the copper coil, but even throw abstinence into that as well, although the decision to abstain, that is human behavior, because you might decide today and change your mind tomorrow. So that one is a little bit, maybe we're not 100% sure, but sterilization, the copper coil, they don't require your intervention. Once it's done, it's done. Once you've had the coil fitted, it's done. It's not like the fertility awareness or the decision to put on a condom, how well you put it on, the decision to use a diaphragm. It's not like the calendar method. Are you getting your dates right? Are you getting the pattern in place? It doesn't have all those elements of human behavior. So these are the questions I wanted to address in this stream today, and I hope this has been helpful. I really wanted to talk about this. I wanted to have this video on the channel because I'm trying to build up as big and effective a video resource library around birth control methods, answering all the different questions that you have amongst them. And I know people are asking about the non-hormonal method. So guys, thank you so much for watching. Thank you so much for joining me on this Friday afternoon. I'm so happy because I'm celebrating Christmas. I'm looking forward to time spent with my family, and I hope you have the same if you're celebrating Christmas or if you're just having some time off with the holiday. And guys, I wish you all the best. We're heading into a new year. What a year 2022 has been. I want to use this opportunity to say thank you to all of my new subscribers. Man, haven't we grown over this last 12 months? It's been amazing, and I appreciate you guys so much. Thank you. And I'm looking forward to 2023. Amazing things that we're going to be doing on the channel. I've got some ideas, and I would love to hear from you as well, what you want to see, what you're interested in. Believe me, I am listening. So guys, thank you so much for joining this stream. Thank you so much for everything that you've done over the last few months, for engaging, for liking, for commenting, for asking questions. Much appreciated. I'm going to let you go now, and I'm going to enjoy the rest of my day, and I hope you do too. And I'll see you again soon. Bye-bye, guys.